We will transition now to Dr. Elizabeth Rice. Dr. Rice has been with us from the beginning since we started doing our BluePaz presentations. Dr. Rice is just such a wealth of information, and she's going to talk to us today about nutrition. This is her part three, so for the people who missed the first two parts, we'll try to do some catch up on that on another series probably. But Dr. Rice, thank you so much for being here with us.
Thank you so much, Dr. Dara. I really appreciate being here. And, you know, as I was listening to Josh and Anna, I just was blown away. And so I don't even know quite how to transition into what I want to present for you, because what they were talking about was so powerful. But I'm starting to recognize the things that I'm going to be speaking about with you guys can be very, very simple and attainable tools for you to use on your healing journey. And I loved how Josh mentioned EMDR and meditation, and a lot about what I'm going to be talking today is breath, and starting to relearn how to breathe and how to breathe correctly. So I'm going to share my screen. Just one moment. Okay. So as Dr. Dara mentioned, this is the third installment of nutrition. And when I found out that this conference was going to be online and the potential to meet a much greater audience, I couldn't limit myself to just nutrition and foods. And I'll talk about why in just a minute. But we're going to be talking about the breath, the body, and the mind, and how to nurture these on a very, very simple, fundamental level. But before we begin, I want us to take a collective breath for our first responders who have fallen in September 11th. And since this is going to be heavily focused on breath, I want to just do a really quick exercise. I'm going to have you place your hands, can't see. I'm going to have you place your hands on your abdomen. And I want, when you take this breath, to breathe deep and deep into the core of your being, okay? So we'll just take a minute and we'll take a deep breath. When you breathe, you'll feel your belly rise underneath your hands. Here we go. And I think it's not just September 11th where we want to honor our first responders, but it's in the everyday calls that they have. And, you know, Josh had mentioned that he was going on what he thought was just a simple NVA, just a simple car accident, which turned out to be really, really dramatic and profound in his life. And so I think you guys come across that every day, all day, and I just want to honor that for you. Another thing that Josh had mentioned, I keep talking about you guys, but it was just so epic, was the why. And, you know, I'm going to talk about a lot of things that you guys can do, and I'm going to be talking about the what and the how. But before we even tap into that, I want to know your why. I want to know why you would even fathom, consider making a change in your physical health or your mental health and emotional health. And so how we're going to do this, and you'll see the instructions on my screen in just a minute. Okay, so you can either respond to this poll at pollev.com, Dr. Dara Ramper 004, or text to the number 22333, Dr. Dara Ramper 004, and I want you to tell me your why. What is the one thing that is most important to me and worth living for? And let me make sure I have it activated. Has anybody been able to respond? Let me try one thing super duper quick. I'll just refresh my page. Ah, there we go. Excellent, excellent, excellent. Our children, right? pollev.com/Dr. Dara Ramper 004, or text 22333 to Dr. Dara Ramper 004. And if you see a word up here that resonates with you, text it in again. Family, grandkids, God, community. These are beautiful. Keep them coming. I want to see your why. Why are you here today? Why are you listening to these stories? Why are you going to start breathing deeply? Why are you going to start exercising or eating well? Why are these things? Service, peace, yes, inner peace, the peace that we'll find within ourselves. Generations, oh, this is beautiful. Again, if you see a word that resonates with you, text it in again. Wife, giving, the generations. Oh, this is beautiful. I wish I had you guys sitting right in front of me so you could tell me the why behind your whys. Your pets, I love that. Our pets are, you know, their little souls are so pure and so honest and so open, and they are 100% unconditionally loving us, even when we are not loving ourselves. Beautiful, you guys. Community, family, kids, love, service. This is wonderful. Couple more moments. Mom, happiness, constitution. Oh, if you wanted to make 2 words, you put a dot instead of a space in between them, because otherwise it'll separate out those 2 words. This is beautiful, you guys. Okay. What I'm gonna do, and you can we'll keep that going. But for now, this is your why. This is why you guys are here, and this is why you're going to take your health into your own hands, and why you might possibly consider doing some of the things that I'm going to talk about. And this is epic, and this is beautiful, and we'll post it on the BluePaz website. That other one I'll leave open in case you guys want to add some more and bring in some more information into that, and then we'll post the finalized version later today. Okay, so I'm going to move on to my next slide. Thank you for participating. Okay, so I want to introduce to you a BluePaz Health and Wellness Challenge. I wanted to make this simple and attainable and easy for you guys to remember what you possibly could do for yourself in those moments of stress, in those moments of incredible intensity. And the rule of 2s is what I came up with. So the things that we're going to talk about is breathing. And what I want to emphasize to you is that I'm going to encourage you to breathe twice as deep and twice as long. And I'm going to teach you guys how to do that and how to do that successfully. Those of you who have been with me in the past 2 lectures, I talk about intermittent fasting every time. I love intermittent fasting because we can attain some health benefits of dietary change. And not all of us in times of stress can, you know, reach for broccoli or canned sardines. It just doesn't happen. And so I'll talk to you about intermittent fasting again. Run, jog, limp, walk, crawl 2 miles a day. This is just to get our bodies moving on a very foundational, fundamental level. When I say daily, I really mean between 4 and 7 days a week, but daily sounds a little bit better for presentation's sake. And then sweating, and I'm not just talking a little bit of underarm sweat like I'm having here presenting to 250 people, but like a dripping, I can't see through my eyes sweat. And if we can do that twice a week, you guys will see profound changes in your health. So why might you even consider doing these? To be the best version of yourself. And I think this statement right here really summarizes: you're either getting better and becoming the best version of yourself, or you're getting worse every day. And I think we can all relate to this on some level. And, you know, we have these waves of motivation that come through our lives where, you know, we're eating right and we're exercising and we're taking care of ourselves, and then we fall off the track. And so I just want you guys to encourage you guys that every day and every moment of the day, you have a chance to make that choice and change the direction as to whether you're improving and becoming your best self, or if you're continuing down the rabbit hole and the spiral. So accountability, I think, is really, really important. If we're talking about making behavior change, if we're talking about making changes in our life, having someone hold you accountable is really important, and I'll help you see that in just a minute. So this quote is quite famous. We are what we repeatedly do. Excellent then is not an act, but a habit. And I just want to say this is not Aristotle, as it most often is quoted, but by an author named Will Durant in 1926 said this. And it's true. What we repeatedly do, it becomes who we are. And so if we are repeatedly drinking, if we are repeatedly spending hours and hours within the self-loathing or the gloominess of the depression, it becomes part of us. And so this whole conference is helping you guys understand how to take steps to move forward. And as Josh said, not even taking the steps, but recognizing the step that needs to be taken and reaching out and asking for help and being courageous enough to do that very first step. This was a study that I'm referencing on New Year's Eve resolutions, and about half of us who resolved to make changes during our New Year's Eve resolutions, we failed to last even 6 months. And our average person makes about the same life resolution 10 times over without success. And so just by making a resolution to change, not all of us are going to be successful. Some of us will be successful, and kudos to those who can implement these things and can start moving forward. But most of us, to make that change and to gain that momentum, it's really difficult. However, if you have a goal that you'd like to complete, if you commit to someone, say your spouse or your friend or your junior firefighter or your engineer, 65% of you will have a better chance at completing that goal. And if you create an appointment, if you put down into your calendar a time to meet with your accountability partner, you will increase your chance of success by up to 95%. So if you tell your wife, I've been thinking about getting counseling, or I've been thinking about not drinking, and she says, that's great, honey. You know, I've heard you say this maybe a couple of times before, but if you decide and you place a date and you say, sweetheart, let's check in 2 weeks on this date and on this time, and I will tell you where I'm at in moving this forward, you've increased your chance of success just by simply doing that and placing a date. So having an accountability partner and then meeting up with that accountability partner regularly will really help you achieve the goals that you guys want to achieve. A couple apps. I think apps are great. This one is called Habit Share. It has a social media aspect, and so you can log all of the habits that you'd like to change, and then you can also have your friends on there to help witness this change for you. So I thought it was great. And then this one I really like. It's called Done. I just think it's pretty. So I think it's an easy app to use in order to help you track your goals and actually hold yourself accountable. Habit Share is free. I think Done is like $20 a year, which kind of stinks. But again, I just thought it was really pretty. Okay, so I had had Dr. Dara send out a message to you guys if you have had any recent blood work done. I think a great way of tracking your health habits is to look at your blood work and to see what's happening within your body. There's so much information we can garner from labs. And so I'm going to show you a sample of some blood work. This was from a recent patient of mine. She's a 37-year-old female, slightly overweight, struggling with depression, struggling with anxiety, and looking for natural solutions to these problems. She's been on 2 medications, an antidepressant and the very strong benzodiazepines for the majority of her life. I think she first started when she was aged 11. And so on reviewing her labs, I really got a great understanding of where her body is at physically. She almost doesn't need to tell me what she's eating and how much she's exercising, because I can glean that information from her lab works. So the first thing I want to point out is the fasting blood sugar. And so this number is not out of range, right? We're within that range. So if we're within range, then we're normal, right? Not necessarily. A naturopathic physician or even a functional medicine doctor would take a fine-tooth comb and look at these numbers and see them on a scale. And that's what I see, is I see all of these numbers on a scale between good and bad. I guess that sounds terrible, but it's true. And so when I see that her blood sugar is at 92, I'm already starting to think that her body's not able to process sugars very well. She's coming up to the higher end of normal. A conventional doctor would look at this and say, that's normal, you're within range, don't even worry about it. But I'm thinking about her 20 years from now, and I'm wanting to prevent what could possibly come in the future for her. So when I see a blood sugar of 92, my ideal blood sugar, fasting blood sugar, is at 75. Now, 75 is quite difficult to attain. Most of my patients who take care of their health and exercise and eat well, they're in the low to mid 80s. And so I'm happy if my patients are in the 80s, but as soon as we're creeping up into the 90s, I know that there's already some dietary, exercise, and insulin resistance happening. The rest of these markers are kidney function and some electrolytes, so I'm not going to talk about those today. Hemoglobin A1C. So we had our fasting blood sugar, and now the hemoglobin A1C is the last 3 months, our average blood sugars. And what we see is that this is seeing how high we're going as well as how low we're going, and it's averaging those all out for us. And when we look at her number at 5.6, I mean, there's this nice little breakdown here. Prediabetes at 5.7, we can actually diagnose diabetes off of the hemoglobin A1C at 6.4, and she's at 5.6. My ideal number is right around 5. Now, this is not as difficult to attain as a fasting blood sugar of 75, because this is taking into account the highs and the lows. And so if over 3 months we're starting to manage those higher blood sugars and we're starting to get a little bit of the lower fasting numbers, it's kind of easier to change our hemoglobin A1C number than our fasting blood sugar. Next is insulin. And so this is the third leg of the 3 prongs of my blood sugar little stool. I like to measure fasting blood sugar. I like to measure the average over 3 months blood sugar. And then I like to know how much insulin is the pancreas putting out in order to maintain the blood sugar in normal limits. And so she's at 22.9. And if you look at that, you're like, oh, she's in reference range. Maybe she's a smidge high, but my ideal number for insulin is right around 5. Side note for like cancer survivors and those who are looking to prevent recurrence, I'd like to see that insulin number closer to 2. And so already here I go, she's having a little bit elevations in her fasting blood sugar. Her 3-month average, while it isn't bad, she's right on that cusp of prediabetes. And now I know that her body's pumping out quite a bit of insulin in order to keep that blood sugar within normal range. So essentially the conversation I had with her is, you're not there yet, and there's so much that we can do to prevent this, but you're on your way to diabetes. Like if you continue the way that your life is now, like that's the direction that we're heading. And my goal is to head it off at the pass and make some simple changes, which we're going to talk about today, to prevent that. The good news that I saw in her labs, the AST and the ALT, those are markers of liver inflammation. And I really, especially on my patients who I'm concerned about insulin resistance or prediabetes, I love to look at the markers of inflammation in the liver, AST and ALT. So for my women and my female patients, I like to see right around 20 or in the low 20s. And for my male patients, in the low 30s. Now, what this is telling me is as insulin resistance and prediabetes becomes a concern, the body starts depositing fat into the liver. And what happens with that is we can create some liver inflammation. And when the liver cells get damaged, they open and they release these 2 enzymes into the bloodstream. So as my patients, as those numbers start to elevate, I get more and more concerned that there's actual physical changes affecting the organs in relation to blood sugar. And for her, I was really excited. I'm like, we're seeing that this trend towards insulin resistance and blood sugar, but it's not depositing into the liver. So like physiologically, I feel like your body is still in a place where it's healthy, and like we haven't seen the damage yet to having these higher blood sugars. So that was really great news that I was excited to share with her. And now if you look at the rest of this, I mean, clearly you can see that these numbers are in the red for her cholesterol and her triglycerides. And so you can think that's bad. Not necessarily. It depends on a number of things. People can have higher cholesterol and higher triglycerides inherited from their family. It can be a genetic predisposition, and that's one thing which I'm not going to be talking about. But if it's related to diet and lifestyle, if I see a cholesterol at 222, I'm not incredibly concerned right now about having high cholesterol. And in fact, I probably would not recommend statins if this was a diet and lifestyle issue and not a genetic. If it's genetic, I think statins are an excellent choice. And if it's really, really high, statins are a great choice. And also what I like to do is I like to do what's called a carotid ultrasound. So I'm essentially getting an ultrasound, which is non-invasive. It's of the carotid arteries, and we're taking a look at whether the body's starting to deposit the plaque within the arteries. And if it's happening within the carotid arteries, we can assume it's also happening within the arteries of the heart, which would lead us to the propensity for a heart attack or stroke. And so in her case, we're going to run a carotid artery ultrasound, and we're going to take a look. If she's starting to deposit plaque, something like a statin or an approach like that by cutting off the cholesterol might be more important. But if she's not and she's clean, she can do a lot of change with just diet and lifestyle. One thing I want to highlight is my crappy diet marker. That's the triglycerides. So I know what my patient is eating based on that triglyceride level, unless of course it's genetic. But ideally what I want to see that triglyceride level is about 75. And people who are eating moderately well in terms of like low processed sugars, low processed breads, and refined products, their triglyceride levels are within normal limits. So I already know that she's eating junk based on that 185 of triglycerides. Her HDL, which is our good cholesterol, is low, and I'd like to see her at least getting closer to 40. If not, my ideal is above 60. So I know she's not getting any omega-3s in her diet. There's no walnuts, there's no salmons, there's no avocado, there's none of that good healthy fats in the diet. And yeah, so here essentially these are the goals. If you guys have your labs in front of you, fasting blood sugar, your goal would be close to 75, hemoglobin A1C close to 5, insulin starting to come down from the teens into the single digits, our AST, ALT markers of liver inflammation around 20s and 30s for male, our triglycerides, which is a crappy diet marker, around 75, and our HDLs, we want to see start boosting those up. Okay, so we all know in order to achieve these numbers, we would want to eat the right things. And the reason that I'm not up here and preaching to you about what you should eat, it's because we all know what we should eat. We should be eating vegetables. We should be eating oily fish, sardines and salmons with those omega-3s at least a few times a week. We know that we should be eating fruits. We know that we should be eating less sugar and maybe not drinking soda, and maybe, like Josh had mentioned, as soon as he quit drinking, his cholesterol panel normalized. Like, we know we should be able to do these things, but in moments of stress and when the body's under stress and we're stuck in that fight or flight, or when we're depressed, I mean, sometimes food is our only source of comfort. And I find that it's really hard for people to change their dietary patterns when they don't feel well. And so the route that I tend to take is we go in from the outside and we make other changes. And then once the patient is beginning to feel better, they can start to make those dietary changes that they know they should be making. And they know how to do. All of you guys know how to eat better. You know it. And if you don't, come see me and we can chat about ways to make that happen. Okay, so breathing. This is the most important thing that I'm going to talk about with you today. So I'm going to save it for last because I like to save the best for last. So those of you who've been with me, intermittent fasting, it's something that I harp on and I bring up a lot, and I just really like it because it's so easily attainable. You can start intermittent fasting today without making any dietary change, and in 4 months you can rerun your labs and you will likely see changes in your blood sugar, in your insulin levels, and in your cholesterol. Now, what intermittent fasting is, it's essentially taking the window of eating and condensing it into a smaller window. Most of us, we eat relatively first thing in the morning. Most of us have like a cream or a sugar in our coffee, and so that starts the fed state the moment that we bring sugar into the body, sugar in the form of food or straight sugar. And then what happens is we go throughout our day and we have our meals and we try to, whether you're doing 3 square meals a day or whether you're doing 5 to 6 smaller meals a day. And then inevitably, most of us have a snack or ice cream at night before we go to bed. And so our fasted state can be somewhere between like 6 a.m. to 10 p.m. That's 14 hours that your body is in the fed state. I think I said that backwards. And thus you're only 10 hours in the fasted state. And the idea is to switch that around. So our bodies are designed to go without food. weeks without food, during times of famine, during times of war, during times of bear attacking our cave and we need to find a new cave. Our body is designed to go fasting, but we don't have those types of stressors, thank goodness, anymore. And food is readily available, and it's cheap, and it's easy, and it feeds our endorphins, and that processed sugar just revs up the brain chemicals, and we feel good, and we get the dopamine rush off of eating the hot Cheetos or the or the donuts or whatever it is that we're reaching for. And so it just has become ever abundant. So the idea is to take that 14-hour window and condense it, ideally into an 8-hour window. That can be a little bit difficult for some of my patients who can't fathom even beginning this process. I'll start with a 12-hour overnight fast. So just make sure that the last time that you eat and the next time you eat the next day is 12 hours, and then slowly work your way up. For those of you who might be more gung-ho, you can just jump right into this 8-hour, the 16-8 intermittent fasting window. For most people, pushing back the first meal of the day seems to be easiest, rather than taking the last meal of the day and bringing it forward. So most people just skip breakfast, water, herbal teas, or even caffeinated teas with no sugar, and then black coffee with no cream or sugar. It can easily be tolerated in that fasted state in the morning, and then first meal of the day right around 12. And then it's not about cutting your calories or cutting the amount of food you're eating, or necessarily even changing what you eat at this point, but it's just about eating all of that food within that window of time. And what we have seen, and I'll show you guys some research, is the benefits from just condensing this window of eating, and it kind of can mimic fasting for us. So consider the 80-20 rule. So you don't have to do this all the time. You don't even necessarily have to intermittent fast more than a couple of times a week to see benefit. It depends on your body habitus and your genetic makeup. But maybe you do this just a few times throughout the week, or maybe you're pretty gung-ho about it and you do it every single day. I just find that for my patients, it's a relatively easy change for them to make, rather than overhauling the entire diet. Okay, here's just a little bit of research that I want to jump into for you guys. I chose this one. It was a 6-week fasting intervention program, and it was for women over 60 years of age. And I chose this study specifically because of the demographics, because of the women, and because of over 60. And the point is that if our women, our postmenopausal women, can achieve benefit, diet and exercise, in an intermittent fasting manner, almost any demographic can. Our female bodies are just designed to withstand change. And so often if my patients, especially in their postmenopausal states, start an exercise or a dietary regime and they're not seeing benefit, I just encourage them to be patient, because our female bodies are designed to not change. You know, versus most of my male partners or patients, I have them stop drinking or maybe cut out soda. They'll drop like 20 pounds in 4 weeks. It's not fair, but it's just the god awful truth. Okay, so what we saw in this study confirmed the effectiveness of intermittent fasting for weight reduction. These women lost body fat by about 1.6%, and they were able to maintain all of their muscle mass, which is really great, because a lot of times caloric restriction can result in decreased muscle mass, and we don't want that, especially in our postmenopausal females. And what we saw with the control group was that 1% of the control group gained 1% of their body weight, where these guys lost almost 2% in the same amount of time. This is a great study, and this is in men with prediabetes. Again, it's another population that can have difficulty with weight reduction and using diet and exercise. And so this was just intermittent fasting, and we saw improvements in the insulin sensitivity, meaning their insulin levels went down, their blood pressures came down, oxidative stress, which is responsible for aging as well as most disease processes, that improved as well with just intermittent fasting. What's interesting about this study is they were focused on the time in which patients were eating. So if you have been intermittent fasting, and this is like preaching to the choir to you, and you're not seeing the changes that you would like to see in your blood sugar and your insulin and in your blood pressure, try shifting that time frame to the daylight hours. And so you will eat during the daylight hours, because most of us 12 to 8 p.m. we're starting to eat into the night. And this was, it was an 8 a.m. to 2 p.m. and again, they did a 6-hour window of eating as well, which can be a little bit more dramatic, but also have more profound results. But they switched the window of eating earlier, and we saw all of these benefits. Their insulin after eating decreased, the insulin sensitivity, meaning the cell's ability to recognize insulin, increased, blood pressure went down, oxidative stress went down, appetite went down, beta cell function, which is the cells that produce insulin, that increased. So we see all of these benefits by eating during the daylight hours. So that might be some food for thought for you guys. This I thought was a great study. This is older adults with mild cognitive impairment, dementia, Alzheimer's. That's something that's a huge concern and has often been called the diabetes type 3. And so being able to prevent something like that with intermittent fasting is great. But I also like this study because it showed a number of things, and I need to move my screen here. So we saw the overall improvement in weight. So they decreased in weight, the BMI, and waist circumference. This was a 3-year follow-up. We saw improvement in blood pressure. We saw reduction of oxidative stress and better cognitive scores. In fact, they reverted back to successful and normal aging 3 years after follow-up. And I just think that's wild and amazing that just by changing the hours in which you're consuming food can have such a profound impact on the body. Okay, so exercise. It's kind of like diet. We all know that we need to do it, but I think most of us have our expectations of us being tanned and fit and jogging with our most lovely partners. But the reality is that we look like a bunch of really skin heavy dogs flapping in the breeze. Those of you who know Dr. Dara know that he is an excellent singer, has a beautiful voice, his sister as well, who's on this webinar. Shout out to Sarah in Trinidad and Tobago. After running for 1 minute, I'm still alive, but I'm barely breathing. And so I know that the two of them are singing that song in their head right now as we speak. Just another funny meme. You've never used your legs before, that's why they're gonna hurt. We can all look sexy when we're jogging, just like Hugh Jackman. And I'm sure this is how most of us feel about going jogging on a Sunday morning. Like it ain't happening. So sorry, all jokes aside, but I feel like even myself too, like I'm no saint in terms of my diet and my exercise, but this is kind of how I do with myself and my exercise, how to begin a jog, walking routine, tie shoes and go. Now, it sounds like it should be that simple, but really it is. If I go back to that quote, we are what we repeatedly do. If we make it a habit and we don't give ourselves that opportunity to think about it, we just do it every morning, just like we brush our teeth in the morning, or at least I hope you're brushing your teeth in the morning. You tie on your shoes and you go outside and you go for a walk. To walk 2 miles in a day, it'll probably take you half an hour to start. If you can begin jogging and incorporating jogging, we're talking about bringing it down to maybe 20-25 minutes. And those of you who are capable runners, I mean, you could be running a 10-minute mile and you can get this done in 20 minutes. So again, just make it a habit, tie your shoes, walk out the door. Our health benefits of exercise, I was going to go through some of the research, but it's kind of ridiculous. I want to show you this. So I just did in Google Scholar, benefits of exercise. I have 65,000 results, 66,000 results. And I just want to point out, this has been since 2020. So there are this many articles written on the benefits of exercise in the last, 10 months, 9 months, where are we? September, 9 months. That's wild. I mean, we just can't doubt the benefits of exercise. You guys could give me the name of any condition and I will find literature to support the benefits of exercise for it. It's just out there. I've often told my students and my patients, if I could encapsulate one thing in this world and give it to my patients as a pill, it would be exercise. Not even necessarily like the best diet in the world and polyphenols, but if I could bottle exercise and give it to you in a pill to swallow, like the benefits would be incredible. That's how I feel about exercise. So I wanted to show, I just did the mental health benefits of exercise, given the topic of conversation at our conferences. And since 2020, it's about 30,000 results. So that is half of the benefits of exercise is focused on the mental health benefits of exercise. And I pulled a couple of specific studies for this. We know that exercise has a large and a significant antidepressant effect in people with depression, including major depressive disorder. For a study to be able to say large and significant, most often studies are like, well, there's a statistically significant probability that this might be helpful. Further studies are warranted, but they were like flat out, it's large and it's significant in terms of helping people with depression. Exercise reduces anxiety, depression, and negative mood. If you guys are interested in looking at these studies, I have the references for you at any point. Exercise alleviates symptoms such as low self-esteem and social withdrawal. And I know so many people, especially our first responders, spend those hours and those days just reproaching themselves and beating themselves up. And that low self-esteem, as simple as just going for a walk daily, can be helpful. I just encourage you to try. Here, this study showed higher levels of physical activity are associated with lower suicidal ideation, which is huge. I'm sure that some of you have had thoughts of wanting to not be here. Some of you have gone to even consider how you might actually take your own life. Some of you have probably looked at that gun in your hand or looked at that bottle of pills and been this close to doing it. And so am I saying exercise in order to help with your suicidal ideation? Yes, among everything else that you can be doing, reaching out for help, talking to somebody, counseling, therapy, getting on appropriate medication support if that's it for you, finding maybe other alternative ways like EMDR and meditation to help you. But maybe move your body a little bit. Walk out the front door as hard as it can be and just go and come back. I guess that's important for people with suicidal ideation. Come back. I know my sister is laughing right now. And move your body. The benefits are there and it can be helpful. Okay, perspiration. Probably the most passive of all of these is to get yourself sweating. Like I said, it's not just a mild sweat. So those of you living in Phoenix, although we're having a really brief stint of cool weather right now, going outside last week and probably next week when it builds up heat again, and doing a jog for two miles, you are going to be dripping in sweat. And that's what I want to see from your body. The health benefits of sweating are numerous. Our skin is our biggest organ. And one of the most benefits to sweating is it gets rid of fat-soluble toxins. So water-soluble toxins are generally not too bad. We drink water, our body can concentrate those in the urine, and then we pee it out. But in order for our body to get rid of like PCBs and BPA, all of these things found in plastics that are endocrine disruptors that can cause and affect changes in our moods. In addition to encapsulating exercise, I would love to go back in time and get rid of plastics. I think it's a huge cause of our mental health, infertility, diseases, you name it. So if we can sweat this stuff out of our body, that's excellent. Detoxing heavy metals, protecting the heart, lowering our stress hormones, getting rid of cortisol, boosting our sex drive. Who doesn't want to have more enjoyable and gratifying sex? Talk about an antidepressant. So the building to a dripping sweat, the way that you can achieve this is, find a gym that has a sauna, sweat it out for 20 minutes. Maybe join a hot yoga class. Any of those who have tried a hot yoga class, you will be drenched in sweat. And that's the type of sweat that I want you to get twice a week. It's incredibly, incredibly beneficial for us to perspire. And again, if that's all that you choose to do is just sweat it out twice a week, recheck your lab values in another 4 months and let me know what happens, because I think that would be really interesting. Okay, breathing. The most important thing, we're going to do some mindful breathing next week as well as later today. So first things first is I need to show you guys how to breathe. There are probably some of you out there who have been natural born breathers from the moment you were born, and you're doing this correctly. Kudos to you. Not everybody's breathing right. I myself am one of these people. This came across my table. I'll show you the book that I started reading 3 weeks ago that has profoundly changed my health, my life, and my own personal anxiety. So this is just a real quick video, and I think she does a great job of teaching us one of the aspects of how to breathe.
Take a deep breath. If you feel like you're going up and getting a little bit taller, you're breathing so wrong. Breathing wrong is when you use your neck and shoulders to pick up your thoracic cavity. So do this now. Take a deep breath and watch. If you feel like you're going up and getting a little bit taller, and then you come down and settle down on your exhale, it's actually a dysfunctional breath. At 5 and under, I found that most kids breathe perfectly. So a number of things happen so that when you ask a 10-year-old to breathe, they start breathing with that upper body breath that's actually anatomically incongruous and leads to us being in fight and flight, more anxious, having neck and shoulder pain, not being able to sleep, and having digestive problems. So how did we get there? Number one is that child starts sitting a lot. They start going to school. We sit way too much, 13 to 16 hours a day. Number two is injuries. If you're a little kid and all of a sudden you start skateboarding or skiing, anything that hurts the middle of your body, you immediately stop inhaling and expanding because it hurts. And your breath goes all the way up here to be an upper body or a vertical breath. You start wearing waistbands, bra straps, compression garments. You start sucking in your gut, and all of a sudden that breath that was perfect before you were 5 turns into a dysfunctional one as an adult, and it stays there until you fix it right now. A good breath, a breath that's anatomically congruous, it goes with the rest of your body, is that you inhale and you expand your body. Neck and shoulders don't move. You expand all the way around, 360 degrees. You come forwards a little bit, your sides open up, and even your back opens up. And if you want to see what this looks like, look at your dog, your cat, your fish, any animal on the planet except for us, and you'll see them breathe perfectly, 360 degrees all the way around, expanding on the inhale and contracting, wringing out, getting narrower on the exhale. No neck and shoulder movement.
Excellent. So I hope you guys were doing that along with her.
Take a deep breath. If you feel like you're going up.
Do that again. Hang on, let me get it ahead of myself. Great. And I hope some of you practice that. The more stressed we get, the more we breathe into the upper part of our chest. And the more that we breathe into the upper part of our chest, that's where the majority of our sympathetic nervous system, nerve endings exist. And so we're perpetuating that stress, right? And so we're activating the fight or flight by breathing up into our upper chest. When we breathe with our diaphragm, which is what she's essentially saying, is she's teaching you how to breathe with your diaphragm as opposed to breathing with your lungs. When we breathe with our diaphragm and we fill our lungs with our diaphragm, there's more parasympathetic nervous system, which is our rest and digest part of our nervous system. And so then we can calm the nervous system by breathing down there. And this is going to take time because most of us have started breathing up high and light, and we just take these superficial tiny little breaths and we don't even think about it. So as you're sitting in the squad car, as you're on your way to a call, just bring attention to your breath and breathe as the way that she described it, that 360 degree expansion, and you will find, I think, an incredible amount of benefit if you can bring awareness and practice to this. I recommend this book, Breath, The New Science of a Lost Art by James Nestor. It just recently came out. Great read, easy read. It essentially has taught me that I've been breathing wrong my entire life, and I never knew it, even though I've practiced yoga and meditation, and I breathe correctly during those times, but the other times in my life, I was never breathing correctly until I read this book. And he does a very interesting study where he and a buddy, they plug their nose for 7 days. And so they're exclusively mouth breathing for just 7 days. And it's fascinating to see the deterioration in their health. Their blood pressure skyrockets, their sleep apnea skyrockets. They start to develop all of these nasty bugs that wouldn't normally be there in the back of their oropharynx, their mouth and nasal cavities. Their stress level increases, their depression increases, all of this by breathing through their mouth exclusively. And so then the second part of the study, they take the nasal plugs out and they breathe exclusively through the nose. And everything normalizes. Their sleep apnea goes down like 4,000%. And so this guy goes even so far as to promote exclusive nose breathing by taping your mouth shut at night. And I'll talk to you about that in just a second too. So if you are not an avid reader, there's also an audiobook for those of you who could possibly listen to the book. It's great. I'll summarize just very briefly for you. I encourage you from this moment forward to breathe exclusively through your nose. And I mean 24 hours a day. The only exception where you can be breathing through your mouth is talking, eating, sleeping, exercising, all of it. Breathe exclusively through the nose. Now, it might be challenging for some of you, and some of you might say, well, my deviated septum and yada, 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 yada. Our sinuses can remodel themselves up into our 70s. And so by starting to breathe through your nose, the sinuses will open. And if they don't open readily, I start to think about allergens, most likely allergens through the foods and food sensitivities that might be causing swelling in the mucosa and the inflammation and all of that discharge. So if you find that you attempt this and you're really, really struggling to breathe through your nose, like go see a naturopath and they'll help you out. It's likely food sensitivities could be one of the reasons that you're not breathing well. Consider taping your mouth at night, and this is going to retrain and strengthen the throat muscles. What happens when we sleep with our mouth open is it causes all of the relaxation in the back of the throat and the posterior throat, and then we start developing apnea, and so we breathe even more through our mouth. And so as the author says, he says, mouth breathing begets more mouth breathing, and nasal breathing begets more nasal breathing. So as you breathe through your nose, you're going to strengthen these muscles again, and it'll take some time, but they will re-strengthen. Learn to complete the exhale. And so what the breathing exercise we're going to do today is called resonant breath. It's a heart rate variability breathing, meaning that our heart rates on our inhale, our heart rate should actually speed up a little bit, and on our exhale, they should actually decrease. And I can hear this in my kiddos, like in the kiddos under 5, I'm listening to their heart rate through my stethoscope, and I can hear when they breathe in, their heart rate goes up. And when they breathe out, their heart rate goes down. And as we age, we lose that heart rate variability, which is an incredible marker for stress. It's a marker for aging. It's a marker for all of the bad things. And so by breathing a 5.5-second inhale and a 5.5-second exhale, that equates to 5.5 breaths per minute. That's what we're going to do in just a little bit. You guys will get a chance to practice that. Completing your exhale all the way out can help you to breathe in a little bit more deeply. So breathe exclusively through your nose, complete your exhale, and then just be aware at different moments through your day, check in with your breath, and you guys will profoundly change your health. Here's a photo of myself and my 3-year-old. You know, she's still at the age where whatever mama does is cool, and so I'm really latching on to that. She sees mama taping her mouth, so she wants to tape her mouth shut. So just to summarize, here's the health and wellness challenge for this year. Ideally next year, I would love to do a formal challenge where we draw your labs the week before the conference. We set the rules for the conference, and then we check in at 3 months, 6 months, maybe 9 months, and then win some epic prizes for you guys. Like in my mind, I'm envisioning a staycation at a beautiful resort somewhere. So I'm just going to put that out to Dr. Rampersad. I know he can make that happen. But for this conference, I just want you maybe to choose all of these, or maybe you just pick one of these and start to move forward. And I tell you, this will help you seek the health, the mental health, and the peace that you guys are looking for. I just encourage you to practice these. Okay, so that's my presentation. It's really strange to do it to a computer, but it is what it is. There's my email. I am very happy to answer any sort of questions you guys might have. I'm going to stop sharing my screen and jump on to the chat and see if there was anything in particular that was a question, or if Dr. Rampersad wants to do that for me.
Yeah, I'll be more than happy to, Dr. Rice. Thank you so much. That was amazing as always, and you always share such fantastic information. And then to see my little niece in there was just the cherry on top. So thank you for doing that slide too. That was really cute.
You're welcome.
We do have some really great questions. In fact, we have one of our cousins who is a first responder in Hawaii, and Craig wrote, with the varying schedules, the 12, 24, 48-hour schedules that most first responder carry in their jobs, what do you recommend they do for managing the intermittent fasting schedule when they can't plan the meal times necessarily?
That's excellent. And so there was actually even a piece in my presentation that I meant to point out. Craig, it would be great if you could do your 12 p.m. to your 8 p.m. And so I recognize that maybe having dinner with a family is really important, or something like that. And so you just make it fit your schedule. So for my shift workers, I encourage them to do their 12 p.m. to their 8 p.m. or, their 10 a.m. to their 8 p.m. if we're going to do a 10-hour fast, and make it work. I find that it is still feasible, but I know that being with family is going to be really important, so you can try to work that in there as well. Thanks for the question.
Thank you. Dr. Rice, husband just recently diagnosed with being diabetic. Can intermittent fasting help?
Yes, but I would go very, very slowly. If you're already to the point of diabetes, I would start with just that 12-hour overnight fast and do that religiously daily for the next, 6 to 8 weeks, so a couple of months, and then maybe go to an 11-hour window of eating and just very slowly work your way towards a smaller window of eating. What you're going to see is you're going to see benefits in the blood sugar, so you'll need to manage your medications well. And so I would hope that your conventional physician would be open to like an intermittent fasting approach. But I can't guarantee that they will. They might just poo-poo it and say that's not safe and it's not okay, but it is. But start just with the 12-hour overnight fast, and maybe you move it incrementally, like a half an hour, every 3 to 4 months, and manage your medications safely.
Thank you.
Yeah.
This person has a sleep apnea machine. They try to get 8 hours of sleep, but are being told that they only sleep in about 4 hours, and 4 hour
Right.
episodes of not breathing 1 to 2 times an hour. How would that work with the technique?
Yeah, and so what you're going to have to do is you're going to have to be breathing through the nose throughout the daytime, and you're going to have to retrain those muscles, because right now the machine is forcing that air in, and your muscles and your body is not breathing for itself. So you have to start during the day, excuse me, and maybe do a couple of the deep breathing exercises throughout the day, and you will slowly be able to wean off of the CPAP with time, but we still have to build up those muscles first. So start and master the daytime, and then maybe you can try the first couple hours at night of the mouth taping. If you want more tutorials on how to tape the mouth, you can go to YouTube, although I prefer just a little tiny one instead of rather over the whole mouth. I think that's just creepy and scary. So again, start slowly and work your way up to that point. And it might have to be those first, once you feel like the muscles have been retrained, it might be just the first 2 hours of the night without the CPAP, and then you put it on, and then maybe 3, 4, 5, and slowly work your way up.
Thank you. This person had a comment. They said they find it interesting that for every health and wellness presentation or class that they go to, is recommended to eat animal derivatives. What's your take on vegetarian, vegan diets?
I think it's incredibly beneficial and helpful. It depends on the individual. And so if a patient is so inclined to eat plant-based, I'm a huge fan of it. Most people eat a lot of animals and they enjoy it. So I do include animal protein for the majority of my patients. But if you could go plant-based, like I'm all for it. But most of my patients, when they tell me that they're eating vegetarian, I'm like, okay, what are you really eating? Because they're really eating mostly carbohydrates. When they're vegan, it's the same thing. And essentially when someone's like, oh, and I'm paleo, and I'm like, yeah, what are you really eating? Just animal proteins. And so just because we label our diet and we say that's what we're eating, 9 times out of 10, that's not true, and it's not what our patients are eating. So regardless of whether you are including animal proteins or not including animal proteins, making sure you're getting enough vegetables is huge, rather than just eating carbs and rather than just eating meat. And so that's kind of the way that I like to focus it. But plant-based diets, I mean, I could do a whole conference on plant-based diets and the health benefits there. So yeah.
I'll give you a low-hanging fruit. Would you please share your rules of twos again? Some folks were trying to get it, and as
Yeah.
we'll be sharing presentations, but if you don't mind just saying the rules of twos again.
You got it. Here it is right here. Breathe twice as deep as twice as long. Eat twice a day with 2 snacks in the window frame. 2 miles a day. Make your body move the 2 miles a day, and sweat twice a week.
Awesome. Thank you so much. Dr. Rice, I'd love to view your research that you referenced specifically about the mental health benefits derived from exercise. You'll be
Great.
sharing that with us, won't you?
Yep, it's included in the note sections of the PowerPoint. So if we're sharing the presentation, you guys will have access to that.
Awesome. Thank you. This person asked, why are women's bodies not meant to change?
To procreate. So our bodies are designed to withstand change so that we can have babies and provide for those babies, right? And so our bodies, and this is true for men too, our bodies will get to a set point and the brain will actually find that set point, and it will be really hard for you to adjust your body one way or the other. If you're underweight and you're trying to gain weight, the body will do everything it can to bring it back to the set point. If you're overweight and trying to lose weight, your body will do everything it can to bring it back to that set point. And just clinically, I've seen women's bodies just be really dang stubborn the older that we get. It's so incredibly often I will hear a patient be like, I changed my diet and I started exercising and it's been 2 months and I haven't seen any difference. And I always have to have, I'm like, patience and kindness towards yourself. It will happen, but as we age, it'll take a lot longer. There's a whole bunch of hormonal cascades. So if you're interested to learn more about that and the set point and all the physiology behind it, send me an email and I'm happy to provide that for you.
That's awesome. I must, of course, tease myself here for a minute, but I was telling Tava, my wife, that the reason my belly is so big is because I breathe properly.
I will just refrain from commenting on that, brother.
but I'm going to try to do your challenge too, though. So you'll have to hold me accountable as an accountability partner.
I would love that. Let's set a date.
Yeah, we will. And so is there a mental and physical reason why eating and exercising becomes so difficult for people, especially if we're biologically made to move and eat less?
That's an excellent question. And I don't know of any studies as to what is happening during major depression that causes the lack of appetite or increased appetite. I know that it's out there, but off the top of my head, I can't bring that physiology up. And I'm sure someone within our audience is like, oh, I know it, it's this. But yeah, I'm sure that there's a reason in terms of what's happening. But I just don't have that information for you off the top of my head, so I apologize.
That is okay, thank you. We have somebody here who asked a question in the chat area, and let me try to get to it here really quickly.
How do you suggest implementing a fasting?
How do you suggest implementing
fasting for people who work out heavy in the morning?
Fasting for people who work out heavy in the mornings around 5 and 6 a.m.
Yeah, so I actually prefer to work out on an empty stomach. If you're looking for like gaining muscle mass and all of that, like this approach is not going to work. But for the majority of our like standard health individuals or somebody who's overweight, I very much prefer exercise on an empty stomach. And so doing the exercise in the fasted state is like the most beneficial. But if you're looking for like muscle gain and all of that, protein before and protein after can be really very helpful. So it's hard to answer that question. But if you are doing even heavy lifting in the morning, doing it fasted, no problem.
That's great. Thank you. Final question for you, because I know that we have run out of time, unfortunately, but do you accept Blue Cross Blue Shield Federal?
For labs, yes. For the office visit, no. And I think it's just a matter of time before insurance companies are going to eventually recognize naturopathic and even chiropractic approaches and start reimbursing for those services, but they don't right now. But that's going to change because of the money that we will eventually save them. But all blood work and imaging, yes, that is not a problem. But the office visit fee, no, it doesn't cover that.
Dr. Rice, you are always so much fun to listen to. Thank you so much for your work that you do with all of us and all of the first responders across the world. And just, you know, we will be in contact with Dr. Rice. You guys will have contact information for her, and we'll share these presentations and recordings later on. Thank you, Dr. Rice.
Thank you. Bye, you guys.
Bye.
Stay safe.